My teacher-made assessment was on socially appropriate behavior of a kindergarten girl. So we looked at her socially appropriate behavior in whole group. We measured her behavior within the first 10 minutes of whole group. So her socially appropriate behavior was defined as the raising her hand to speak, also waiting for the teacher to stop speaking before she spoke to her, and not speaking while instruction was going on, which was usually to the peer next to her. This behavior caused her not to be able to pay attention during whole group, as well as her peers who were around her not to pay attention. We measured both that socially appropriate behavior as well as the inappropriate behavior which she was exhibiting. So the inappropriate behavior was talking out of turn during instruction. Talking when she was not called on. Also talking to the neighbor next to her while instruction was happening. So the intervention that we employed was the planned ignoring intervention, which was established by ignoring the student Molly, who talked when she was talking. If she was talking during instruction, then the teacher would keep instructing, would not respond to her at all. And then once Molly exhibited socially appropriate behavior by raising her hand to speak, then the teacher would immediately call on her and positively reinforce that behavior. So the intervention was actually done before in a research study by Hendrickson and Gable in 2009. Their study did planned ignoring, but in a more extreme environment where kids were had behavioral disturbances and were very violent, throwing chairs, using foul language, things that were not acceptable at all. And they used planned ignoring and had a very positive effect on the children. We collected data, or I collected data, by using a whole interval approach. I assessed her socially appropriate behavior, socially inappropriate behavior, and no behavior at all. So the graph that I did looked at the baseline of socially appropriate behavior, which was very low. It averaged at 15% of time collected was using socially appropriate behavior. During intervention, the planned ignoring intervention, socially appropriate behavior drastically increased to an average of 65% of socially acceptable behavior. I collected reliability by having another teacher collect data at the same time that I was during a 10-minute interval during whole group. She received the same behavioral definitions that I used so that she could collect the data in the same way that I did. Since this was done at the same time, I did not use a video to score the child's behavior. I did receive 90% reliability in the time that we did the dual collection during intervention. The results that I found was that socially appropriate behavior did increase by using the planned ignoring behavior. I think what this teaches is that instead of teachers using negative approaches to socially unacceptable behavior, like stopping instruction to say, "No, Molly, don't do that." That was ineffective during baseline. That was what the teacher was doing. And obviously, it was ineffective because Molly's behavior was to continue that inappropriate behavior. The teacher's negative approaches did not affect Molly's behavior, but when the teacher changed in implementing the planned ignoring intervention, Molly's behavior did change drastically in the socially appropriate manner. This shows that when teachers use either positive approaches or ignoring the situation that they do not want to occur, it shows the student what to do and what is acceptable in a positive manner without using a negative approach.